Welcome to Wellbeing Wednesdays, the virtual learning series bringing the best minds in healthcare to your digital doorstep. In this episode, Dr. Laurie Santos, professor of psychology at Yale University and host of the Happiness Lab podcast, will moderate a candid and forward-looking discussion between Vice Admiral of the U.S. Public Health Service, Surgeon General of the United States, Vivek Murthy, and Chuck Ingoglia, President and CEO of the National Council for Mental Wellbeing. To start things off, here is your Wellbeing Wednesday moderator, Dr. Laurie Santos.
Hello and welcome. My name is Dr. Laurie Santos. I'm a professor of psychology at Yale University and host of the Happiness Lab podcast. And today I'm so excited to be moderating this Wellbeing Wednesday panel on our nation's well-being. Where do we go from here? I mean, it is no secret that our country has been battling COVID-19 for almost a year and a half now. This awful disease has taken the lives of over 600,000 Americans and more than 4 million people worldwide. But this pandemic has also had a devastating effect on our mental health and flourishing. And so the goal of this panel is to not only make sense of the impact of this awful disease, but to also get a sense of where we're going, to kind of figure out what are the best policy solutions that we're going to need to flourish more in the future. Because for better or for worse, this awful pandemic has given our entire planet a moment of a new, fresh start. We can start to rethink how we prioritize our mental health and what our governments and industries and policymakers should be doing to continue to promote human flourishing, not just to recover post-COVID-19, but to improve our happiness in general. And today, I'm so excited to be joined by two fantastic experts who I'll have introduce themselves quickly. I first want to invite an introduction from Chuck Ingoglia, President and CEO of the National Council for Mental Wellbeing. Chuck?
Laurie, what a pleasure it is to be with you today. And Dr. Murthy, I have the pleasure of leading this organization that represents almost 3,400 organizations around the country that provide safety net mental health and addiction treatment.
Fantastic. And I'm also incredibly excited to be here today with Dr. Vivek Murthy, the 19th and 21st Surgeon General of the United States. Dr. Murthy, would you like to introduce yourself?
Sure. Well, thank you so much, Laurie, and so nice to be with you, Chuck. My name is Vivek Murthy. I'm an internal medicine doctor by training, a father to two little kids who are 3 and 4 who keep me busy, and also have the privilege of serving as Surgeon General of the United States.
Awesome. So I think we'll start this panel first by talking about the state of U.S. mental health kind of before COVID-19 to get a sense of the challenges we were facing back then. Then we'll pivot to how our mental health has changed during the context of this pandemic. And then I hope to some really practical solutions, the ways that policymakers can use this fresh start moment well to improve people's flourishing. So Dr. Murthy, I wanted to start with you. As Surgeon General, we often think of your job as looking out for the general health of our nation. And I think we often think of that in terms of our nation's physical health, things like smoking and obesity. But one of the things I've loved about your service is that mental health has always really been a focus for you. Even in your first administration, I think this was something you thought about a lot. And so I was wondering if you could share with us the story of, how you kind of got on this path. I remember you telling the story of a listening tour you did when you first started up in your role and how that really affected how you thought about mental health. So can you share that story with us?
Well, absolutely, Laurie. Well, I was privileged during my first tenure as Surgeon General to begin my time in office with a listening tour, traveling across the country and asking people how I could help. And that was really my effort to learn about what was happening across our country. I had seen health through the vantage point of a doctor, having cared for thousands of patients over the years and understood some of the challenges they faced. But I wanted to really begin my service with a much broader look at America. And what I heard on the one hand were some things that didn't surprise me, challenges that people face with obesity and heart disease, cancer, and other chronic illnesses. But I also heard a great deal about people's struggles with substance use disorders, with mental health challenges, particularly with their kids. And this was surprising to me because, as a doctor who had primarily cared for adults, to hear parent after parent talking about their concern about anxiety and depression in their children was an eye-opener. And the other thing that I heard, which I really did not expect to, were people's struggles with loneliness, where people would often say to me that they felt that they disappeared tomorrow, no one would even notice. And when they would talk about the burdens that they carried with them, whether that was economic burdens or social pressures or other health challenges, they would often say they felt they had to carry those burdens alone. And so the more I listened, the more I heard that our mental health was on the minds of people all across America, that it was not only impacting how they felt, but it was having spillover effects on their physical health, given the tight connection we know exists between mental and physical health. It was also impacting how they showed up at work in terms of productivity, how they showed up in school in terms of performance, as well as how people showed up for their families and in their neighborhoods. And it was even impacting our dialogue, our ability to talk to one another, which we know in the polarized times we live in, is really an essential part to breaking through and reconnecting people with one another. So that was what I saw when I began my tenure last time. And I think, in the years that followed, up until the pandemic, I think the state of our mental health was marked by high levels of anxiety, depression, and loneliness, by limited access to resources to help, and also by an unfortunate stigma.
And so, Chuck, do Dr. Murthy's observations match what you're seeing at the National Council for Mental Health? Like, are these the same kind of big issues that the council is focused on before COVID-19?
Well, absolutely. I think, Dr. Murthy's experience on that listening tour is consistent with every single national poll that has ever done about the state of mental health in this country. You think about it from multiple levels. If public health departments do community health assessments, and what I heard from my wife, who works in public health, is every one of those community health assessments comes back with the number one or two issue being mental health and substance use. If you look at surveys of the general population, people report, if they experience mental health or substance use, they're asked, why don't they seek care? And the same three issues come up in every one of those surveys, in not always in the same order, but the same three topics. I don't think I can afford it. I don't know where to go. And I'm afraid to ask for help because of stigma. So those are the three things that the National Council tries to take on in different ways, whether through our work focusing on policy, how do we create access to care, whether that be more funding, promoting integrated care, practice improvement, helping clinics increase their throughput so that they can see more people, that they can deliver evidence-based practice, and through our efforts around public education so that people feel comfortable picking up the phone and asking for help. And I know from my own family, my mother lived with a severe anxiety disorder that prevented her from leaving the house. And it wasn't until I was in social work school that I understood what was going on. It was just, mom is weird. And how many families have that same kind of experience because they don't have the language to understand what's happening to people that they love.
So these were the kinds of things that we were seeing, before COVID-19, the problems that are out there, the stigma, not getting enough care. What do we know about the impact that the pandemic has had on these things? Chuck, maybe I'll start with you. I mean, I know the data aren't fully in yet, but what have we learned so far about the impact of COVID-19 on our well-being?
Well, so what did Dr. Murthy talk about? High rates of depression, anxiety, and loneliness. Let's see. Being in your house for a year, cut off from everything that gives you joy, might lead to increased levels of all three of those things. And I think that's what the data seem to be reporting, right? Depression and anxiety were already running in the 20 to 30% range in terms of prevalence. And that seems to have increased. When people responding to surveys, it's like 47% of Americans are saying that they, are experiencing some of those symptoms. There's some debate about the numbers related to suicide, about whether they're accurate. But, I think we're going to need to keep our eye on that because, we're not quite out of the woods yet, but certainly one of the most alarming statistics has been the increase in overdose deaths. We had some temporary reduction, but we've certainly seen those spike. And if you think about the corresponding increase in alcohol sales that have happened during COVID, I think that also contributes to anxiety and depression. So I think all the indicators are pointing to that this is even more of an issue. And I think that's also what I've heard from so many people is that they're seeing depression and anxiety and substance use problems in their friends and families that they had never experienced previously. So it's, I think, both the data as well as people's own experience are kind of saying the same story.
So, Dr. Murthy, how is this affecting your role? I mean, it must be so interesting to have seen these mental health issues during your 3 years in the Obama administration. Now you're walking back into this role in the middle of a deadly physical health global pandemic. We're worried about vaccines and variants and so on. But, mental health is another big factor that might be just as deadly. I mean, how has your administration thought about the data that are rolling in about the effects of COVID-19 and what we should be thinking about?
Well, Lori, it's, I think, part and parcel of this pandemic. And I think that is where we start, is by recognizing that the mental health challenges that we're seeing that have gotten worse during the pandemic, the increase in substance use disorders and overdose attempts and deaths for many, this is not separate from the pandemic. We have to think about this as part of the broader impact of the pandemic and hence address it with the same urgency that we are approaching the vaccination effort to help turn this pandemic around. And that was frankly one of the things that President Biden and I had spoken about on a number of occasions over the past year. Was as the pandemic was building in 2020, we would speak often about these twin challenges around mental health and substance use disorders that were arising during this pandemic. And after he began his time in office, he also, and even just before that, he asked me to work with him and the rest of the team on taking a broader approach to mental health and to the addiction crisis that we have in America, recognizing that they were worsened by the pandemic, but they also predated the pandemic. So the first thing I want to convey is that there is a very clear understanding of how important these issues are and the urgency with which we might address them and must address them from all the way from the very top of the administration, from the president. But a couple other things I would say here too is we also recognize that there are some populations that have been hit harder than others. We know that for people who have struggled economically prior to the pandemic was extraordinarily difficult. Many people lost their jobs or they worried they were going to lose their jobs. Many people may have kept their jobs but seen a reduction in their paycheck and may have struggled to figure out how to provide food on the table for their kids and work while also trying to manage virtual learning for their children. So the stresses of this moment were enormous. And like so many crises, they fell disproportionately on those who were struggling struggling economically, racial and ethnic minorities, who have traditionally suffered with the disparate impact of crises like this and poor health outcomes. But there's also another population I just want to call out, one that we perhaps don't think about nearly as often, but that is a population of public health workers and clinicians, our doctors and nurses and other frontline health workers. And what we've seen in terms of statistics, in terms of how this pandemic has impacted their mental health and well-being, has really been staggering. We have more than 50% of frontline health workers who are now saying that they are burned out, and many of whom are considering dropping out of the profession. We have 53% of public health workers in state and local and territorial and tribal health departments who say that in the last 2 weeks they've experienced symptoms of anxiety, depression, PTSD, or suicidal ideation, or other mental health challenges. These are not small numbers. These are the people that have kept us safe during the pandemic and who we will rely on throughout the rest of this pandemic and even afterward to provide care for the rest of our health. But they are struggling. The helpers need help. And if we look across the board, we recognize that if we do not address the mental health needs of our country with urgency, focusing not just on expanding treatment, but also focus on investing in prevention programs, on shifting this broader culture to eradicate the stigma around mental illness, then we will struggle for a long time. We will hurt, all of us, whether you're struggling with a mental health condition or not. You likely know people who are. And that means that the people in your life will be affected.
Dr. Murthy, I'm just want to just comment on a couple of things. One of the things that the National Council has been able to do over the last several months that I'm very proud of is to partner with the National Association of State and Territorial Health Officials to offer support to their members in terms of resiliency and self-care during the pandemic. We have a whole series going on actually right now. This is the second time that we've offered this support to them, and we've also broadened it to include state mental health commissioners. And I think lots of people in state government right now are feeling a lot of stress. Also, really just wanted to touch on your comment about how do we begin to build resiliency. One of the things we've noticed that other countries are working on kind of post-recovery resiliency plans. And we've had some conversations recently with ASTO where we're trying to figure out how we might be able to partner going forward to really kind of promote that kind of infrastructure.
I mean, I love these ideas and the pivot. I mean, I think, one of the things we wanted to get out of this panel was to sort of talk about where we are. And the fact of the matter is that where we are is not, very good. Like, our citizens need help. The helpers need help. This is a really challenging period. But, in the spirit of this happiness class that I teach at Yale and my podcast, I often spend a lot of time talking to my listeners about benefit finding, right? This act of, even in challenging situations, finding the silver lining to give you some meaning to move forward, to kind of meet these challenges. And I think if I had to think of, a silver lining, there can be a silver lining to, a deadly pandemic that's literally destroying people's lives. I mean, I think really the benefit that we can get out of this moment is what Wharton psychologist Katie Milkman calls a fresh start. We know that, it's a tough time to sort of change policy around, to completely redo something, or to change our own habits around so that we can behave in a totally different way. But, Katie's research has found that there are these moments when we are a little bit more prone to do it, when our mind is ready for it, when our mind is ready for policymakers to say, hey, we're going to do something completely different now. And the hope is that this global pandemic can be that sort of moment. We even talk about it. We use our language to talk about this moment as a new time. We talk about a post-pandemic world, right? Cutting off the world from, before to after. We talk about the new normal, right? We really are poised to kind of make this cut and to try something new. And so I think it really is an exciting time to be thinking about, okay, what is our national strategy going to look like, right? What is the new normal? And so that's where I wanted to go with the rest of our discussion. What are the opportunities that you both see for real change? And what's your vision for the kind of change you want to see? Maybe starting with Dr. Murthy, this fresh start moment, I think, is a really maybe exciting one for a Surgeon General, the position to be in, right? Where you can really think about these big changes. What are some of the kinds of big changes you're thinking about nationally, and what's the kind of vision you see for our country in the future?
Well, Lori, I think you're exactly right. There is a really profound silver lining to this pandemic, which is the opportunity to rethink how we live our lives. And there may have been many things we assumed we had to do before, that we had to work in a certain way, that our children had to learn in a certain way, that we had to live in a certain place far away from the people we love, because that's just what you do when you grow up. But I think the pandemic has given us an opportunity at a tremendous cost, mind you, in terms of lives lost and lives, really turned on their head. But it's given us this chance to rethink some of those assumptions, to reimagine a different way of life. But there is a window for us to do that. If we wait too long, I think many of us will just slip back to 2019 as our default state. But this is a moment where we can ask the fundamental question, what do we want to build our lives around? And if I think we're honest with ourselves, like my guess is that many of us, and I would put myself in this box, have built our lives around work and around the pursuit of what society tells us we need to acquire in order to have worth and value. And those three things are usually power, wealth, and fame. Right? And we look at people who have achieved some or all of these. We write books about them. We make movies about them. We tell their stories on the news. We hold them up as examples of what all of us should strive to achieve. But if you think about it, many of us know people who are rich or wealthy or famous or all three, and who are profoundly unhappy. And so I think the question that we have to grapple with is, what truly does bring us health and happiness and fulfillment? And how do we build our life around that? And I think one of the most profound lessons of the pandemic is that it is our relationships with one another that are an extraordinary source of health and happiness. We know that social connection is good for our physical health and our mental health. And many of us have felt just either by missing it or by enjoying it if you've bubbled with people that you care about, just how profoundly important social connection is in our life. So the real tough question is, what do we do about that? And I think there are at least 3 steps that we've got to go through here. Number one, we've got to open up a conversation in our lives, in our families, in our neighborhoods, in our work communities, and in the country at large around what we've learned from this pandemic in terms of what matters to us and what we want our life to look like in the future. For some people, that might involve profound changes, moving to be closer to your family, changing your work because maybe you're not getting as much meaning from it as you wanted to, spending more time with your children, or making perhaps other big changes. For other people, it might be minor tweaks. But what I find is that with the absence of actually considering these questions and having the conversation, the default is we will slip back to 2019. The second thing we've got to do is lay out some actions that we can take, recognizing that the actions aren't going to be the same for everyone. The conclusions and takeaways from this pandemic are going to differ from person to person. But once we have the opportunity to reflect and have a conversation about it, we need to identify maybe just one thing to start with that we might do differently, like in our lives. And then the third thing we've got to do is support one another in continuing that dialogue and in taking action. Any change is difficult. I spoke to a doctor just yesterday who made the decision after years of working in Atlanta to quit her job and to move to New Jersey to be closer to her family. Now, that's not easy. She's got to find a new job. She's got to build a new community of friends, etc. But she felt that after everything she went through in the pandemic, that she couldn't go through her life anymore just taking time for granted. Time is our most precious commodity. It's what we can't renew. And she thought, if I've got only a limited amount of time left, why am I not spending that with the people that I love? And so she's making her move home. Now, everyone is going to have a course of action that's right for them. But for me, and this is something I think about in my role as Surgeon General as well, I want to do everything I can to support individuals and communities in having this reflection, this conversation on what we want our lives to look like post-pandemic. Let's not consign ourselves to be the victims of a future that we did not create. But let's recognize that we can actually build and design the future that we want. It won't necessarily be easy. It won't happen overnight. But we have an opportunity to reset, to make that fresh start. If we do so, I believe we can come out healthier, happier, and certainly more fulfilled.
I'm with you on the dream and love that the dream is also focusing so closely on social connection, right? And the fact that we can support each other in developing this social connection. And that sort of gets me to a point I wanted to ask Chuck about, because I think this is one of the spots where the National Council is really thinking ahead on these kinds of things about, forms of treatment that rely on the goal we have to connect with one another and the kind of impact that we can have on people, even people who are really suffering, if we just kind of reach out. And so I wanted you to talk a little bit about one of the programs I know the council is really focused on, this idea of mental health first aid, which I think might be exactly the kind of thing Dr. Murthy is talking about here. So what is mental health first aid, and what have you shown that it can be really powerful for helping us with?
Yeah. Mental health first aid is an incredible program. It's an international program created in Australia that teaches people the signs and symptoms of mental illness and substance use, and how to engage a colleague, a friend, or a family member who might be suffering. So that story I told earlier about my mother, that our family would have been the perfect audience for that, to really just understand that this wasn't just mom being weird. This is a thing called an anxiety disorder, and that are treatments available to help people like that to get in, to have fulfillment in their lives, to thrive. And so to date, about 2.5 million Americans have been trained in mental health first aid, and that's everywhere from in schools to fire departments, police officers, and everybody in between. And, one of the incredible things I know, like, for example, some police departments or fire departments have done it to really focus on officers or who engage with the public. But what they found is that it's had an incredible effect for them personally. They have high rates of anxiety and depression, and now they have new language to understand what's happening with themselves and to feel more comfortable accessing care. We're really encouraged, as New Jersey, for example, as part of their kind of post-COVID resiliency plan, is investing a lot in mental health first aid and trying to bring it to schools across the state. And we hope to be launching a new version of mental health first aid in the next in the spring. I'm sorry, in the fall. We're in the summer, so in the fall, that's focused on teens. So it's a shorter version of the course, and it's really to encourage teens to seek help and to talk to trusted adults if they're having problems.
And so one of the reasons I love mental health first aid so much is, a couple of reasons. One is it focuses on this problem we were talking about before, which is we need to find ways to help the helper, right? And if we create more helpers out there who are trained not just to help other people, but know the signs and symptoms in themselves and some strategies and who to reach out to if you're going through that, I think that can be incredibly powerful. But it also seems like a kind of policy-based structure that we can use to sort of achieve this idea of social connection, right? To rethink, in some ways, the individualism that I think we've gotten into. Dr. Murthy so nicely put it that we're going for fame and power and money and whatever. I think we can forget that what we really should be going for our own flourishing is a sense of community, is a sense of being out there to help one another and to sort of see what we can do to aid the suffering of other people. And this seems like a kind of policy intervention that gets people more in that mindset and gives them skills that they can use to do that. And so, Dr. Murthy, I'm wondering, especially given the focus on social connection, are there other kinds of things we can do to do that? If the vision is to get us to rethink things, to rethink the social time that we have with others, what are kind of policy interventions that you're thinking about that we can really do to get that? I'd like to kind of get there because it's a wonderful vision. And I'm like, let's do it. But how do we do that?
Well, it's a great question. I mean, thinking specifically, Laurie, if you're asking about social connection, I think there are policy levers that we can use to strengthen social connection. But I do want to say from the outset that the quest to build a more connected society is one that requires all levels of society really taking action. There are important decisions that we and only we can make in our own lives about how we prioritize relationships, about where we spend time, about whether or not we make it a priority to bring our full attention to our conversations, or do we allow our devices to invade our conversations and distract us, which many of us do. I've done that on many occasions, but it really diminishes the quality of our connection. We can also make decisions about whether we choose to seek each other out with opportunities to serve, recognizing that it is through our service to one another that we actually forge some of our greatest connections and remind ourselves that we are in fact not alone, and that we have worth and value to bring to the world. These are all things we can do. And I think of them in simple terms. Spend 15 minutes a day reaching out to people you care about. Make sure you're fully present when you're speaking to and catching up with the people you love. And look for ways to serve, even if that's simple. Even if that's calling somebody to check in and see how they're doing because they've been having a rough time. Even if that's dropping food off. There are many, many ways to serve. So those are individual things we can do. I think at an institutional level, there are also a number of things we can do. If you are a workplace, you can think about what you can do to design a culture that actually emphasizes and strengthens and encourages the building of strong social bonds in your workplace, recognizing it's not just nice to have, but it actually contributes to productivity and creativity in the workplace. And the contrast is that when people are lonely in the workplace, it diminishes their productivity and actually has impacts on the people around them. If you're a school, you can also think about the fact that relationships are so critical, not only to the happiness and well-being of a child, but to how they do in later years in terms of graduation rates, in terms of their likelihood of running into trouble, in the criminal justice system, in terms of their physical and mental health. And so the curriculum that we put in place in schools to help invest in social and emotional learning is incredibly important to supporting our kids' mental health now and in the future. And finally, Laurie, if you think about government, at the local, state, and federal level, government can play a really powerful role in bringing people together and establishing issues as priorities. So for the government to point to an issue like loneliness and social connection and say, this is a critical issue for us to address, and it has impact on our physical and mental health, as well as on our productivity and our kids' performance in school, that is an important statement for government to make. Government can also bring people together to address those issues and to do so, on a common timeline, with a collective strategy. And government can also produce policies that can help too, policies that invest in research to better understand the drivers of loneliness and the interventions that help enhance social connection. They can also help drive policies that look at the social impact of other policies. We tend to look at the financial impact of policies when we're considering go or no go decisions. What if we looked at the health and specifically the social health implications of our policies? That could have a profound impact on how we approach public policy. So across the board, whether you look at it at a government, institutional, or individual level, there are important steps that we can take to strengthen social connection in our life. And I mention this because we have the power right now, each of us, to make seemingly small decisions that can make a big difference in how connected we feel and how connected others feel to us. So we don't have to wait for government to act or for our workplaces or schools to metamorphosize and change. We can make those decisions right now. Spend 15 minutes with someone else, to give them the gift of our full attention, and to find small ways in our day-to-day life to serve one another.
I think these kind of small day-to-day decisions are so powerful, in part because we know that they can wind up helping us solve other problems that we face. So one of the recent results in this positive psychology literature that I love so much is that, we sometimes don't, take time to help other people because we're worried about our own time. We feel so busy and time famished, it's hard to do that. But there's some lovely work coming out of Ashley Willen's lab showing that the act of taking time to help someone else makes you feel like you have more time, not less, right? Like the act of doing for other people, you think if you spend time on other people, it's going to like decrease your happiness, but it'll help someone else. But actually what the research shows is that it's not a zero sum game. Like actually investing in other people helps everyone. It's sort of big, it makes the pie bigger. And so I think that this idea of helping other people is interestingly a way to help ourselves, right? You wind up making other people feel less lonely, but then you feel less lonely yourself. And I think this is so important for the population that I work with, like college students and teenagers. I know this is something, Chuck, that the council has been focused a lot on. So as you hear Dr. Murthy's suggestions for some of these ways of promoting social connection, but these are the kinds of things that the National Council is thinking about specifically in teenagers. What are you all up to in this domain?
Yeah, we have a few initiatives focused on young people, and they're really different from any of the other things that we do at the National Council. We've really designed these to be kind of youth voice focused, or where their youth are playing a leadership role in determining what the initiatives look like. And we're also doing weird things like partnering with very non-traditional organizations, faith-based groups, gay and lesbian groups, who are all trying to figure out how can they engage young people in conversations, not treatment, but in conversations that promote positive mental health. So those are the things that we're doing. And I have the privilege right now of also being involved in an initiative with the Brookings Institute focused on youth mental health. I like calling my family and telling them that I'm involved with a think tank. They get a big kick out of that. I never thought that would be something possible for me. But I think, to Dr. Murthy's point, is really thinking differently about what we offer and how we engage. And I think the COVID has really presented a lot of opportunities. We're already doing that before, but it's really challenged us to think differently about what services are going to look like into the future.
It's great. I was going to ask Dr. Murthy, you were about to say something before, so I want to pause and let you jump in if you had something else to say there.
Well, something you said I just found very compelling. I mean, the idea that service is something that actually enriches us and doesn't just take away our time and energy, I think is really powerful. But there are two other things I think that happen that for which service can be a powerful antidote. When we are struggling with our mental health, when we are struggling with the weight of everything going on in our lives and the stress that comes with a pandemic, but that many people experience pre-pandemic, one of the things that can happen is we can experience a diminished sense of power as we feel more and more of our life is outside of our control. And we can also experience a diminished sense of self as we feel less and less worthy and more like a failure. And I say this not from theoretical knowledge. I say this from my own lived experience. Since I was a child, I've struggled with loneliness. I've experienced what that does to your self-esteem, to your sense of self, to your agency. And I've experienced that in a number of times during my adulthood as well, including when I was training in medicine at various points afterward as well. And it's a struggle that many people go through, in their day-to-day lives. But when you feel a lack of power, when you feel that you don't have worth or a sense of value, that is a downward spiral that can just drag you further and further away from any sense of relief and deeper into pain. But one of the things that can pull you out of that, often rapidly, is service, is actually taking yourself out of your lane of concern and investing yourself in making someone else's life better, even whether it's for a few minutes in a conversation or for a longer period of time. So that is actually one of the reasons why I think service is so important. It's good for other people, but it's part of the diet that we need in our own lives to be mentally healthy and resilient. It reaffirms our connection, our sense of worth and value. And as I think about our kids, that's why I think service has to be a key part of how we raise children. It's part of a healthy lifestyle in the same way that eating healthy food and leading a physically active life are part of what make us resilient and strong.
I love that you use this word, sort of nutrition and diet. This is one of the ways I've started talking to some of my students about the sorts of things that they need for a life of flourishing. Just as the, National Nutrition Council gives you your plate and it's like, oh, it should be this many vegetables and this many proteins. I think we need to start thinking really critically about what we need for human flourishing. I think so many of the spots where we're seeing mental health issues come up is in part because we're not eating the right mental health diet. We're not getting the right social connection. We're not finding the right moments of meaning and so on. And so I think kind of planning this out so that we're getting the right mental health and flourishing diet is going to be really powerful. We only have a couple minutes left. And so I kind of wanted to sort of go back, to the beginning. This whole panel has really been about a fresh start and our kind of vision for the future. And so Dr. Murthy, I think, in part because you have this unique view where you served, pre-pandemic in these idyllic times, when we thought things were bad then and now we're here, hopefully you'll be in your role for a very long time. But, when you come back as the 23rd Surgeon General of the United States or the 25th Surgeon General of the United States, what's your hope for where we'll be? What would you like to look back on your administration and see, it had done in terms of mental health?
Well, Lori, I would love to see, number one, the stigma around mental illness eradicated. I'd like to see us talking about mental health the same way we talk about physical health, without a sense of shame, with the recognition that it is part and parcel of our overall health. I'd like to see that we have ready access to treatment, that it's integrated with primary care, that we don't feel ashamed to actually seek out treatment, and that we've also invested in prevention programs, of which we have many that have been shown to work. And the evidence is there, but we're just not investing in them. What I'd also really like to see, perhaps more importantly than anything, though, is I'd like to see more people be able to lead their lives with confidence that they are pursuing what matters to them, that they are building relationships, that they're spending time with the people that they love, that they are living life on their terms and creating the future that will drive their health and their happiness. And if that happens, if that's the case, and if that happens because we've had the conversations as a country, because we've, in a sense, given ourselves and each other permission to build a culture where it's okay to move to be closer to your family and to give up what might be a prestigious job, where it's okay to prioritize your relationships in your decision-making in life, to me, that would be a major step forward. And think about the message that sends to our children, right? I spoke recently to a group of students at a university in California. And what they told me again and again and again is they felt imprisoned by this hustle culture, as they called it, a culture that pushed them to have fancy internships, to get into fancier graduate schools, to get fancy jobs with fancy titles and fancy offices with fancy paychecks. All the while, they felt that they weren't truly happy. And I asked many of them, I said, when was the last time you can remember in your life when you felt true joy? Not joy because somebody else told you you had achieved something and patted you on the back, but you felt an intrinsic sense of joy that you were doing what you were meant to do. And almost all of them said they had to go back to middle school to think of a time in their life when they felt that way. And these were all college students. So what I would love to see more than anything else, and in part because I'm the dad of two small kids and I'm thinking about the future for my children as well, is I want our kids to grow up in a society where it's okay to prioritize people and encouraged to build your life around relationships. I want our kids to grow up in a society where we help each other when we stumble, where we pause and give each other the benefit of the doubt before we judge one another, when we seek each other out to understand instead of to hurl attacks or insults at one another. That's what I would really love to see. And how long will it take to happen? Well, that depends on us. Change can happen remarkably quickly when people make up their minds to live in a different way, to prioritize something else. I think this is our opportunity for a fresh start to prioritize people and relationships, to get at the heart of what truly matters for our health and happiness. That's what I would love to see in the years ahead.
Fantastic. And I think what a wonderful way to honor the struggle and the challenging time that we've been through. Hopefully this is our only sort of end of a global pandemic rodeo that we're going to see in this century, right? I love this idea of making such good use of it and really to use it as an opportunity to think big about what we should be doing to promote our mental well-being and flourishing. And so with that, I think we are out of time. Let me thank my fantastic guests again for a wonderful conversation, and to thank the National Council on Mental Wellbeing for promoting it. Thank you all so much for having us here today.